Hi, how are you, everyone? I hope you're doing well. Yeah, so we are talking about the advantages of home care services. Okay, and one of the key topics that we have been talking about is wound care. Okay, and why we are emphasizing that wound care needs to be done by a nurse in a home care setup. So you have a wound, or you went for surgery. After surgery, you've been discharged, you go back home, or maybe you developed a diabetic wound, or maybe you had a knee replacement done, or you had any type of surgery that was done and you have a wound, or you injured yourself, accident, and you developed a wound. And you have been seen in the hospital. After that, you have been discharged, and they advise you to be cleaning the wound. Okay, that's why we are advising that the public that you need to involve a professional nurse to come and clean your wound. And we, under Therapeutic Home Care Center, we are providing such a service. Okay, so wound care is important when it's done by a professional nurse at home. Why am I saying this? Is that it reduces hospital visits. Okay, because if a wound is done properly and the wound is healing, there is reduced chances of you visiting the hospital frequently to be assessed if the wound is getting better or worse, because the nurse would have given you good feedback on how the wound is doing. Okay, the other advantage is that it's going to save you time. Okay, you don't need to be going to the hospital or doing it's going to save you a lot of time, especially the family time. You just get feedback, oh, your uncle has been cleaned, or your dad has been cleaned, and the wound is like this, like this, like this. Everything is going well. We talked about early detection of signs of infection. We talked about following aseptic techniques. We talked about a lot of things that a nurse is able to see in a wound as it being cleaned, because assessment in wound cleaning is very important. Okay, so yeah, having a nurse coming to clean you, it reduces time, and also it saves time on you as a patient and also as a family together. Okay, the other advantage is that it reduces stress. Okay, the stress of you worrying about your relative being in the hospital, you don't know what's going on. So you are, that patient is being cleaned at home, everyone is taught, everyone is seeing what is happening, and a patient is in a familiar environment, they're able to see what is being done, and feedback is given there and then. Okay, so it's we are advising that having a nurse clean your wound at your place, a home which you are familiar with, and all everything is there, assessment is done, wound cleaning is done, signs of infection checked, and everything is good, you are standing at an advantage of having quality care being done at your home.